Well, it's the leading cause of death for both men and women, killing more than 600,000 Americans every single year, and the risk for heart disease only grows with age.
So how do you talk to your parents about their heart health on Heart Health Month, about the warning signs of this potentially deadly disease? Dr. Marc Siegel is a member of our medical aid team, and his dad had heart disease. So you know this personally, right, Dr. Siegel? You're a doctor, and your dad wasn't telling you.
Because he's a big denier, my father, and he would be sitting there having symptoms and not telling anybody. So the first point is you need to have a go-to person that you're comfortable with. It's usually not the spouse, by the way. You know, the big, tough man is not going to turn around and tell his wife, hey, I don't feel well. So he did tell me after a night of chest pain, I drove out of my car, picked him up, brought him to the hospital. He got a cardiac stent, and he was saved. After that, he started to tell me more when he wasn't feeling well. That's the key. Who are you telling? And men and women are different, by the way, Sandra. You were saying your mother's the tough person in the family.
No, so is my dad. Sorry, Dad.
Okay,
but I do feel like women, they don't want to bother their children when they are not feeling well or potentially having a problem.
And they may not know. You know, women, it's the #1 killer of men and women. Women may have more atypical symptoms. For men, it may be chest pain.
What are some of those warning signs?
So for men, it may be chest pain, shortness of breath. You may be sweating. You might have that with women, too. But women might just feel really fatigued or a little bit of nausea or some tingling. It's a little bit more likely to be atypical. But you're not feeling well. You get to the doctor. I like to overreact to heart disease, Brian, because I don't, even if I don't think it's your heart, I want to get you into the hospital to make sure.
But you could rationalize any of those things away. You know, I have chest pains, but I had Moe's last night, you know, or Chipotle or something.
No, absolutely. But
that's what happens.
But you know what? I want to be wrong 9 out of 10 times, because the one time that I'm right, I can save a life. If you think it's Chipotle, I may think it's not.
Right.
All right, so is there anything that we can do today or tell our parents to do today to prevent this from happening down the road? How do we keep our heart healthy?
#1, and this is American Heart Month, #1, know your risk factors. If you're a diabetic, if you're overweight, if you smoke, if you have a family history of heart disease, the way I do, this is something, and your cholesterol. You want to know what your cholesterol and your blood pressure is. You should be carrying that information around. Wow. You're treated for high cholesterol. You're treated for diabetes. You're a smoker. You're overweight. You're elderly. The older you get, the more likely this is to happen. You should know about it in advance. You should see a doctor regularly. Maybe your doctor, Sandra, is your go-to person. Maybe that's the person you call in the middle of the night. I get plenty of calls from patients saying, I don't feel quite right. I always overreact. It's what I'm supposed to do.
Doctor,
lose weight, stop smoking, stop drinking.
Can I talk to Sandra for a second?
Sure.
Sandra, he rolled through that full screen as if he memorized it. I've never seen anything like it. You didn't even wait for each button. Each one rolled down.
That's how I passed courses in medical school.
It's incredible. Can you believe this?
All right, so my takeaway, though, is it's better to overreact to having any of those symptoms. Tell someone.
Right.
Because everyone's worried about the inconvenience of a hospital emergency room. You know what's more inconvenient? Having damage to your heart. We have a certain period of time when we can save you. Tiny blood vessels. I could send somebody to a catheterization lab, put in a stent, reopen the vessel. It's miracle medicine these days.
All right, Jack.
Soon we'll be able to do the stents ourselves at home with the stent comb kit. Thank you very much, Dr. Siegel.
Thanks, Dr. Siegel.